Well, hello there. Hey, welcome back. My name is Jodi Scholes. I am your instructor for the MBLEx review course. Woo woo! We are here with all of these yummy, wonderful people studying for the MBLEx, the Massage and Bodywork Licensing Exam. And today's session is on the benefits and effects of massage on the soft tissue. Yes, so the benefits and physiological effects of massage on soft tissue. Yes, class is going to go in 3 parts today. The first part is some test taking strategy and a couple of bonus announcements. We'll move into the learning, full plate today, fair warning. And if you need to hop off at some point, hop off. We can have you come back in later if you like. But it is a full class. We're going to run just a little bit long probably today, just a little bit. And then part 3 is the dissecting of questions. Yes, we have some great questions for you to pull apart and find the best answers. So let's begin with a test taking strategy. So there's 2 things I want to share with you today. Number 1 is a new addition to your online learning center. Tara and I are committed to continuous improvement in your studying experience. And on your dashboards right now, I don't know if you've noticed, but on your dashboards right now are 3 new things. For all your silver members who get all the bells and whistles, there are 3 new medical terminology quizzes. As we were assessing our curriculum, we were a little light on teaching you medical terminology. Tara has prepared for you 3 Quizlets so that you can test your medical terminology knowledge. Yay! So go find those on your dashboard. If you're a silver member, go find a silver or gold member, go find those on your dashboard. I think you're going to love them. So, and if you're not a silver member, feel free to upgrade. If you're hanging in there at the bronze level is cool. It's very self-directed, self-paced. You get the practice exams, but once you upgrade to silver or gold, then you get all of the deeper dive lectures as well. So those medical terminology Quizlets are there for you right now. So don't go now, go after class. All right. The second part of the test taking strategies today is to understand the importance of test taking stamina. Test taking stamina. Yes. So what is test taking stamina? That is your ability, and we're going to test it today. We're going to test your stamina today. That is your ability to focus for 2 hours. Stamina. It's like running, right? It's like playing tennis. It's like watching a movie. Can you focus for 2 hours, for 120 minutes? Our practice exams, which are available at the bronze, silver, and gold level, so all 3 membership levels, you have unlimited practice exams. Taking those practice exams is a critical part of your preparation. Sometimes I'm asked, hey, how do I know I'm ready? How do I know when I'm ready? How I know you're ready is when you take a practice exam, you finish in under 2 hours, between an hour and 20 and an hour and 50 is what I'm looking for. That you finish in under 2 hours and you pass with a 70 or better. Do that 3 times, and you, my little eagle, are ready to be pushed out of the nest. Push, push, push. Yes. So once you pass that practice exam at least 3 times with a 70% or better in under 2 hours, I consider you very ready to take the MBLEx. Yes. That's what you're going for in this class. That's what you're preparing for. That's what we sit and do lessons for. That's why we do our learning, to build your test-taking stamina. Now, some of you don't have an issue with time. So finishing in under 2 hours is actually not a problem for you. Be cautious, because going too fast also can cause a problem. And we'll address that later when we talk about our dissecting the questions, because I am anxious to get into our learning. So, as a recap of our test-taking strategy for today, number one, you have additional material on your dashboard, Quizlets. Quizlets for medical terminology. So that is, if you're an all access member, depends how long you've been here. If you have all access, if you have all the quizzes um, and classes, those are on your dashboard. All right, that's number one, medical terminology. Number two, pay attention to your test-taking stamina. We want to build it up so that you're comfortable at the 2-hour mark. All right, so that's a summary of your strategy. Let's move into our learning. Here we go. Here we go. Here we go. Here we go again. All right. The benefits and effects of massage on soft tissue manipulation. This is the direct wording now from the Federation. Soft tissue manipulation. So welcome back. Going to be an awesome study session today. So a reminder, here in this Patreon community, we focus on what matters. There's a lot of stuff out there you can study. And many of you guys have told me, oh my gosh, part of the reason I signed up for this membership is because I had no idea what to study. I get it. There's a lot out there. Yeah. We here help you to focus on what matters. So that's what we're doing today. Here is the copy from the Federation on this category, benefits and effects of massage. So we look at the physiological effects, we look at the psychological effects, we do specific special populations, what type of strokes are being used. We need to understand the different effects of different strokes that are used. We need to understand the effects of hot and cold applications. And then in a separate lecture, we talk about alternative bodywork modalities. We're not going to talk about alternatives today. We're digging down on our 11 systems of the body today. We talk about alternative bodywork modalities in a different lecture. These are our 11 systems. Yippee, yippee. And we're going to talk about all of them. And this actually shows you 12, but they have the male and the female reproductive systems separate. So I'm covering them in one. So in terms of studying, we do need to think about the individual systems of the body. And our course material in the anatomy and in the physiology dives deeper into what organs make up the system and what is the function of that system. But that is anatomy and physiology. Today, we're talking about the benefits of massage to each of those systems of the body. So I'm going to give you a brief recap on what is in those systems of the body, and then we'll move on to the benefits of massage. That's our focus for today. Let's start with our favorite, the muscular system. All right, benefits of massage to the muscular system. As a reminder, there's 680 muscles in the body. We have 3 types of muscles: skeletal, cardiac, and smooth. The skeletal muscles are voluntary. The cardiac and the smooth muscles are involuntary. How does massage benefit the muscular system? Well, of course, it relieves tension in the muscles. It relaxes the muscles. When the muscles relax, that simply means it reduces the excitability of that muscle. It reduces the excitability of the sympathetic nervous system, calming down the fight or flight. So when someone says, "Oh, I have really tight muscles," we could say they are really excited muscles. They're hyperexcited muscles. But by calming down the muscle tissue, by warming that muscle tissue, we calm down the fight or flight response. But we'll talk about the nervous system here in a moment. Massage has been documented to relieve muscle soreness and fatigue by introducing fresh oxygen and nutrients through the bloodstream into the muscle tissue. So that is how muscular, nervous, digestive, cardiovascular, how these systems are intertwined, right? And so, how massage relieves muscle soreness, introducing fresh oxygen, moving out that waste-filled blood out of the system. Massage therapy helps with helps reduce trigger point formation in both the muscle and in the fascia. And with the mechanical effects of massage therapists can manually stretch, manually separate, spread out muscle fibers. That's an example of the mechanical benefits of massage. Massage also helps to improve performance and balance. So when muscles are tight, they don't work as well. When muscles are tight, they don't work as well. So when they are loose, when they are balanced, they work more optimally. In addition, massage helps to increase flexibility, again, by stretching those muscles, broadening those muscles. Lengthens muscles by stretching. And again, that can be traditional stretching where you're actually stretching a muscle, or lengthening the muscle with a nice long effleurage stroke, a deep effleurage stroke. And in certain conditions, I'm specifically thinking of the special population, the elderly, massage can help to improve the tone of muscles, can help to improve by providing oxygen, nutrients to that tissue. If someone is living a sedentary lifestyle, if they're elderly, if their immune system is compromised, if they have a disease and they have a more sedentary lifestyle, massage can help to improve the nutrient delivery to those muscles. So that is how massage benefits the muscular system. Little summary. Feel free to jot down any questions that you may have, and you can ask them when we wrap up. So if any of these don't seem familiar, or you'd like a deeper dive into how the massage affects any one of these benefits of massage to the muscular system, make a note of it. Now, I touched on the mechanical benefits of massage, and after almost every time we do this lesson, I get asked about, could you clarify the benefits of massage as far as mechanical versus reflexive? So I'm going to spend a couple of minutes talking about mechanical effects. All right. They come from a specific type of stroke. So we're looking at, think about this in your own mind's eye: cross fiber friction, compression, and tapotement. So you are going to need to know the names of the strokes of massage beyond effleurage and petrissage. There's one more in there called pincement. Pincement is pinching. But today, in this moment, we're talking about strokes that create a mechanical benefit of massage. I like to think of it as polishing the car. Do any of you have a car polisher? Oh, I was going to bring mine over and show you. I have one. And this car polishing tool is an external tool, right? So when we use external tools, we can also create a mechanical effect. For example, cupping, right? And fun fact, if you have one of these car polishers, you can use it for self-massage. In fact, I'm going to show you because is the car polisher. Yes. And has a little dial, nice flat chamois surface. And I use this for self-massage. It produces a mechanical effect. So the car polisher produces a mechanical effect. Let's take a look. So what are mechanical effects of massage? Well, it can remove dead skin cells. I should say skin cells. It allows our sweat glands, our hair follicles, our sebaceous glands, the oil glands, to be free of obstruction. So it can clean out pores, and that way they function more optimally. Mechanical effects when we warm the skin, and of course used in the treatment of scar tissue, cross-fiber friction and adhesions with cross-fiber friction can be loosened, improving the flexibility of the skin. Mechanical effects of massage, say over the lungs for tapotement. So if we do a little cupping, little pop, 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 right? When we do that over the lungs, usually posterior, if you haven't tried that before, so in the thoracic region of the spine, it can jostle and shake and allow mucus to be freed up, therefore being coughed out or spit out. I know, a little gross, but true. All right. Massage, the mechanical effects also encourage hyperemia, the histamine release, and we're going to talk specifically about histamine in just a moment. It increases the suppleness of the tissue as well. And of course, massage can reduce edema, swelling, specifically through manual lymph drainage or through manually moving that extra fluid up the leg or wherever that swelling has occurred. So let's redefine hyperemia. Hyperemia is increased blood flow into the blood vessels. So take a peek here. I love this picture because it's pink. It's pink. All right. So be very clear that, well, let me tell you, vasodilation, the mechanical stretching action of massage can cause those blood vessels and the skin to dilate, to widen, to get bigger. Dilate is to get bigger. So we're stretching, we're doing something physical that causes the blood vessels to actually dilate, allowing more blood flow through to the area. Hyperemia, in effect, will soften that muscle tissue so that the fibers can be worked a little bit deeper. So hyperemia is that pink coloration. It's evidence that the blood vessels have dilated and more blood is coming into the area. Now, in this example, we're using a gua sha scraping tool to create the hyperemia. But in massage therapy, we will often use compressions, the compression technique, to displace blood that is there. Stay with me. Stay with me. Mechanical effects. So compression is what we're talking about. It's an outside force. So in this image, there's a picture of someone doing CPR, doing compressions on CPR. In CPR, when we compress, we are mechanically making the heartbeat. We're actually compressing because the muscular contractions have stopped. And we need blood flow in the body. We need that blood to continue to flow so that oxygen is delivered to essential organs. We manually, mechanically pump the heart through CPR, through compressions. When we compress the glute, let me take a step back. When we compress the chest, we push the blood out, and when we release, the natural forces bring more blood into the heart. So when we compress, we push that blood out. Makes sense, right? When we compress a glute, we are doing the same thing. Yes, and that term is called temporary ischemia. Temporary ischemia. So it's only temporary. We're pushing that blood out of healthy tissue and new blood comes in. That's why it's temporary. So out, the ischemia is out. And that's a benefit of a compression. It's a mechanical benefit of massage. Pressing down with a compression, creating that temporary ischemia so that new blood can flood in. Okay, these are mechanical benefits, right? So temporary ischemia, compression will produce it. The blood flow is compressed out of the tissue. This is manually moving blood through the tissue, mechanically. Here you have a picture again of compression. And then these are compression leggings. You may see them at your gym. I was introduced to them through professional cyclists who needed to recover their legs to recover more quickly. And so not only are these cold, these they used to be called compression boots, but now it look like they're all the way up. But these compression pants, I should get the name of that, are not only cold, but they also squeeze. So they squeeze from the toes up to the quads, back and forth, mechanically improving the circulation. All right. Now, having explained mechanical benefits, I want to note that pretty much 95% of the benefits of massage are reflexive. They're not mechanical. So let's start there when asked a question about what type of benefit this is. Default to reflexive and convince yourself that it's mechanical. So what are the reflexive responses of massage? Lowering the blood pressure. The heart rate slows down. There's more rhythmic breathing. I see here 85%, like the majority of the benefits of massage are happening internally. Reflexive has the word reflex in it. Reflexes are involuntary. So these reflexive responses are ones we're not thinking about. We're not actually changing. Reflexive benefits are always a part of massage therapy. So calming down our nervous system, our overall nervous system, and we'll get more specific about the nervous system in just a few minutes. But this is the compare and contrast. Skeletal system, our bones, right? What are the benefits of massage on the skeletal system? Massage can increase range of motion. And at first, this looks like a muscular benefit, but it depends where the adhesions are occurring. So if it's adhesive capsulitis, frozen shoulder, there are different techniques to use to improve that function. So in this case, the muscular and skeletal system are intertwined because range of motion happens at the joint. And so we want to improve that joint health and the muscular health, the joint balance and the muscular balance. Massage can promote fracture healing. And you'll hear me say this multiple times today. By delivering fresh oxygen through the bloodstream, the body repairs. By delivering fresh nutrients through the bloodstream, the body repairs. And so when we look at promoting fracture healing, this is delivering fresh oxygen into where that fracture has occurred. Improving the muscular balance and thereby skeletal alignment. So if you decide after you pass the MBLEx to work for, say, a chiropractor or a physical therapist, by improving the muscular balance, by improving the flexibility of the muscles, the stretching, the lengthening of the muscles, the skeletal system is easier to adjust. In fact, when you do massage and you've loosened muscle tissue, and then you ask your client to just take a deep breath, it's quite common to hear pop, 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 because once those muscles are softened, the skeleton can move, can align. It's also beautiful for after an adjustment. I personally prefer it before for an easier adjustment, but after the adjustment to help that adjustment hold. Massage is beautiful to soften the muscles around those areas that needed adjusting so that those muscles don't just pull out, pull that vertebrae, pull that skeleton out of alignment again. So we need that muscular balance for the skeleton to be aligned. Joints are also nourished by the joint fluid, which is in there, which is moved and circulated by massage. We talk about manually stimulating joint fluid. What is that joint fluid called? Do you remember? Put it in the chat. Stick it in the chat. What is that movable joint fluid called? Let's see. Good, looking in here. Ooh. You got it. Oh, I just cruised right on by. Okay, let's see. Yes, Dantasia. Good, Isha. Yep. Excellent, Diane. I don't know if I said hi to you, Diane, but hi. Lydia nailed it. Good. Yes, Lek. Yes, Miss V. Yes, Carrie. Good. The movable joint fluid is synovial fluid. Look at you guys. I'm so proud of you. That was like no big deal question, right? Good job. Excellent. So synovial joints are movable joints, and those movable joints are lubricated by synovial fluid. Yeah, that's what we talk about when someone says, oh, I'm going to get an injection into my knee. Well, that synovial fluid, isn't moving around too much, or it's a little light. But before they ever do an injection, try massaging around the kneecap. It's fabulous for stimulating synovial fluid. All right, back to the message at hand. Let's move along to our cardiovascular system. And this is the big papa, right? The OG of our systems of the body. So we got muscular, skeletal, but the cardiovascular takes us everywhere. So cardiovascular or circulatory system, what does it do? It transports nutrients, transports oxygen to our cells. It removes carbon dioxide, removes waste product from the cells. It transports hormones, transports different types of blood cells and immune system cells. A lot of this is done in the lymph system too, but hormones, blood cells, mostly going through the cardiovascular system. And of course, helps to fight disease, stabilize temperature, your pH balance, the acidity in your body, and helps to maintain homeostasis, of course. All right. What does massage do for the cardiovascular system? What are the benefits? Well, we talked about dilating blood vessels. So by manually stretching, right? Manually stretching. Sometimes the body dilates on its own, right? And we'll talk about that as a benefit of massage as well. But when we mechanically stretch, that allows those blood vessels to expand, that improves circulation. So by dilating the blood vessels, it improves circulation. Another way to dilate blood vessels is through heat. When you put a hot water bottle or a hot pack, say on your quad, it turns pink, right? Heat also helps to dilate those blood vessels. Massage will decrease blood pressure, creates hyperemia. It does create that pink, that evidence of massage, evidence of new blood flowing in. Hyperemia, that pinkness. Obviously, it feeds the cells and tissues with oxygen and nutrients, promotes the removal of waste so we can increase the concentration, or not necessarily increase concentration, but it will speed up and at times increase concentration as well, to be honest. So, yeah. You know how, like, when you don't drink enough water in the day, that your pee is really yellow? That's because your body's getting rid of a lot of waste through your urinary system, but it didn't have a lot of water. But have you noticed when you drink a lot of water that your pee is lighter? That's what we're talking about as far as improving the removal of waste. That's usually through, well, it's through all sorts of different systems in the body, but driven by the cardiovascular system. Massage reduces ischemia. So ischemia are blood deficient areas of a muscle. Ischemia. Sometimes you hear about an ischemic attack. That's in the heart. That's when there's no blood in that area of the heart. Yeah. But we look to produce temporary ischemia, right? We've used that word already through our compressions. But massage reduces ischemia, say, for example, in a trapezius muscle, right? That upper trap muscle, right? Up in here. It can be a bit ischemic. Not a lot of blood flow going through there because it's so tight. So by warming it, by stretching it, by cross fiber or friction, we can reduce the ischemia in those areas of the muscle where their circulation is deficient. Feet, another great example. Feet are just about like, well, they have blood flow, obviously, but like, it's not like your heel, right? Just doesn't have the same kind of blood flow that your quad does, right? So we can improve blood flow in reducing ischemia. All right, reduces the heart and pulse rate because things slow down. Increase the stroke volume. Hold on a second. What the heck is stroke volume? Okay, stroke volume is the volume of blood pumped out of the heart's left ventricle during each cardiac contraction. Okay, cardiac muscle is involuntary. It just works, and we're grateful it does. Question. So stroke volume is the amount of blood pumped out of the left ventricle. Where does the blood go? For those of you who have studied the pathway of blood through the heart, you can tell me the valve or the name of the area that when leaving the left ventricle, where is the blood going? Chatty chat, give me a chat. Anybody got it? Let's see. Okay, everybody's thinking. Everybody's thinking. So remember, all right, track that blood in, right? Where does the blood come in? Comes in the right atrium, right? We're up here in the right atrium. It enters there because we're using gravity to take it to the right ventricle. And then it's going to shoot out through the pulmonary valve and pulmonary. I skipped a valve, but let's go back to the right atrium. Try before you buy. Through the tricuspid valve into the right ventricle, out through the pulmonary valve, pulmonary artery, grab some air, grab some lungs, grab some good stuff, get rid of carbon dioxide, come back into the left atrium, bicuspid valve to the left ventricle. All right, let me see. Where does it go after the left ventricle? Ooh, Lydia, nailed it. Ooh, there was somebody else who just did dentation. You got it. Exactly. Now, once you tracked it, you knew where you were, right? Yes. So where does blood go when it leaves the left ventricle? It goes out through the aorta. Yes. So this is the left side. So after it's so the blood is in the lungs right now, and it comes back to the heart, oxygen rich. It's red, oxygen rich. It comes in the pulmonary through the pulmonary vein into the left atrium, through the bicuspid valve or the mitral valve. You can just call it bicuspid. Hits the left ventricle, and then whoosh, that contraction of the heart, the systolic contraction of the heart, shoots it, boom, through the valve and out the aorta. Yes. Good. Good, good, good. And if this is new to you, or you're like, what the heck are you talking about? You will need to know the pathway of blood through the heart. Just saying. Okay. So so the left side, one way you can remember that is the blood has left the lungs, and it goes to the left side of the heart. It comes in the left atrium, down. Yeah. Okay. Good. All right. Back to the cardiovascular system. So it increases stroke volume. Now you know what that means. The amount of blood leaving the body, leaving through the left ventricle into the aorta. It increases red blood cell count. And how does it do that? It improves the delivery of oxygen to the bone marrow. So it can increase the red blood cell count. It also increases the concentration of saturation of oxygen in the blood. It's called oxygen saturation. So again, delivering oxygen, delivering nutrients. It increases the white blood cell count, again, delivering more volume. It also, massage can help to enhance the adhesion of migrating white blood cells. So that means increase the white blood cell's ability to stick to where it needs to go. It has a target cell that it's going after, or it's looking for infection. Massage can help to enhance the adhesion of white blood cells that are kind of still floaters. They're still out there looking for something to do. So, fun fact, and that's that the average adult has 5 to 6 quarts of blood. If you're living in the metric system, that's about 4.5 to 5.5 liters of blood, but 5 to 6 quarts, which is made up of plasma, red blood cells, white blood cells, and platelets. So red blood cells, white blood cells, platelets all hang out in the plasma. That's our cardiovascular system. All right. Moving along to the lymphatic system. Might recognize this image. We're going to be talking about our immune system response. So, lymphatic system is the lymphatic vessels, lymph nodes, lymph vessels that are throughout our body that carry lymph, a clear fluid called lymph throughout our body. So, how does massage benefit the lymphatic system? Look, I would love to go through all of the anatomy of the lymphatic system again, but go watch the anatomy lesson on the lymphatic system. Right now, we're going to talk about the benefits of massage to the lymphatic system. So it promotes lymph circulation, increases the lymphocyte count, which is so the lymphocyte count. And how do we know that? Well, look, National Institutes of Health did a study, and that is that weekly Swedish massage stimulated a sustained pattern of increasing the circulating lymphocyte. Goes on to do a bunch of other good things. This is all scientific language, but I wanted to show you there's studies, research being done on the benefits of massage. This one happens to be NIH. You can look this up yourself. PubMed is the PubMed Central, and you can see also the source here if you're coming back. So in this image, the lymphocytes, we just talked about increasing the circulation of the lymphocytes. And you can see here the lymphocytes are the blue and they're attacking the yellow. So this is a foreign body. In this case, it's a cancer cell, but the blue are multiplying and attacking, getting rid of that foreign body. So massage helps to increase the number of these lymphocytes in the system. It also improves their function, makes them happier, makes them more efficient. And these are the CD4, the killer cells, the natural killer cells, the CD4s, CD4 to CD8 ratios. Again, if you want to know more about that, look at our lymphatic system anatomy and physiology lecture. Oh, I want to just point out mast cells. I talked about so mast cells have to do with your immune system. They are made in your bone marrow, but you don't really need to know too much about mast cells, except that the term comes up every now and then on the MBLEx. These are like the reinforcement cells. So they're mature mast cells. They live in tissues throughout your body, and they come to the rescue if you need backups. So it's like, okay, the initial attack did not absolutely kill the infection. Mast cells will show up. They're also sometimes the first responders. So, but for the purposes of the MBLEx, all you need to know is that they're a part of the immune system. And look what happens. Mast cells switch on. It's kind of like if there's an infection, somebody's pulled the fire alarm. So mast cells will release histamine. And you may have heard of antihistamines, right? So to calm down a histamine response, we might take an antihistamine because that mast cell sprayed out all of this histamine, and it like creates mucus and it creates like pink blotchy skin. It sometimes makes people swell. So a histamine response is also an allergic reaction. A big histamine response is an allergic reaction. But there's modulating types of immune system response, allergic response with histamine. Sometimes it's blotchiness, sometimes it's swelling. But really what the histamine response is doing is isolating those that foreign substance. So say, for example, something simple like dust or pollen, right? So all of a sudden it goes, spring has sprung and the pollen index is way up there. And you're like, yeah, I'm cool. I don't have allergies. Until this one day where, you're in Washington, D.C., smelling the cherry blossoms and the pollen rate is high. And all of a sudden you're taking in through your nose a lot of pollen, maybe some dust, maybe some other stuff in the air. And all of a sudden, achoo, your body responds by sneezing. That's releasing those foreign bodies. If a lot of foreign bodies get in there, you may see some type of reaction like this, like the blotchiness can be anywhere in the body where those mast cells have released additional histamine to help get rid of a foreign body. So, how does massage benefit the lymphatic system? It helps to keep these mast cells ready to go, either as first responders or backups. Or if there's just too much. Oh, we went to this fight and we were sorely unprepared. Boom. I went to DC. I smelt the cherry blossoms. Whoa. Had no idea it was going to be like, whoosh. And this isn't just environmental. It can be food, food that you usually don't eat. All of a sudden you eat some type of ethnic food and there's a spice in it that, ooh, my body is now processing, digesting this spice. All right, our nervous system. How does massage benefit our nervous system? So much intertwinedness, right? Muscular, nervous, circulatory. Let's take a look specifically what happens with massage on the nervous system. Reminder that we have two sides of our nervous system, the central and the peripheral. The central nervous system is the brain and spinal cord. The peripheral nervous system is everything that is not the brain or the spinal cord. Literally everything that is not the brain or spinal cord. Yeah. So cranial nerves actually are peripheral. Even though they're in the cranium, they're not part of the brain. Okay. So with the peripheral system, we've got the somatic and the autonomic. And we're going to take a deeper dive into the autonomic. Autonomic means involuntary, right? It happens automatically. Therefore, somatic is voluntary. We'll revisit this again momentarily. But when we look at the nervous system, what part of this nervous system is responsible for the fight or flight? Is it the sympathetic or the parasympathetic? Which part of the nervous system? Go ahead and put it in the chat. This is Nervous System 101, you guys. Gonna need to know this. Yeah, yeah. We're gonna talk all about the benefits to both sides of the nervous system. But which side is responsible for fight or flight? Good, Karsha. Carrie, yes. Isha, yes. Alicia, yes. Like, I'm not sure what you're referring to on that one.
Sympathetic.
Sympathetic. Thank you. I appreciate that. Lydia nailed it. Diana, yes. Vanessa, yes. Very good. So, little hint, I would feel sympathy, right? So it's the sympathetic nervous system that's responsible for fight or flight. Our parasympathetic nervous system is rest and digest. So now let's look at some of the benefits of massage to both of these systems. These are the big ones, right? This is where a lot of the magic happens with massage therapy, is in the nervous system. So reminder that we are over here in the peripheral nervous system. We're in the autonomic, the involuntary. Somatic is simply the voluntary. It refers to our skeletal muscles and being able to voluntarily move. We think, okay, flex my elbow. That is done from a command system in the brain through the central nervous system out to the somatic nervous system. It's voluntary. Right now, we're going to be talking about the involuntary responses. And so the reflexive responses of the nervous system. So a reminder of what I just said, that the somatic nervous system is voluntary. It's the movement of our arms, legs, that we consciously control. Okay, let's take a look at the benefits of massage and compare sympathetic versus parasympathetic nervous system responses. So when someone has a fight or flight response, we would feel, oh, I feel sympathy for them. Sympathetic. If you have any challenges, remember which is which. I have sympathy for people who are always in fight or flight. So sympathetic nervous system. Okay. So what happens when someone goes into fight or flight? And in just a moment, we're going to compare this to what happens when they rest and digest. Benefits of massage to the nervous system. But let's start with somebody's in fight or flight, their pupils dilate. They're like, oh my gosh, I got to watch for predators. What is pupil dilation? We talked about blood vessel dilation, but pupil dilation is when they get bigger. And this has been seen on the MBLEx, talking about pupils. Come on now. Yeah, okay. But what is it when you dilate your pupil? If you've gone for an eye test, or are considering cataract surgery, sometimes you need a ride home because they dilate your pupils. So they make them bigger and wider. So here, constricted pupils. This is an example of just red eyes. And then dilated pupils. The color is less because the pupils are bigger. That pupil is the dark spot in the middle of the eye. The color is called the iris. Yeah. So the pupil is that dark spot and the iris is the color. All right. Let's walk through our sympathetic, what happens in fight or flight. So pupils dilate, boom, they get big. Saliva, down. We're not resting and digesting right now. So you might feel a little bit of dry mouth. Sometimes when people are nervous about public speaking, they get a dry mouth. It's a form of flight or fight. So saliva production goes down. Mucus production goes down. Like we don't have time to deal with getting foreign bodies out of our system. We gotta we're about to fight. We're about to run for, 20 miles or fight off a predator. Heart rate goes up. Bronchial muscles actually open because they're going to they relax, so they open because they're going to be breathing hard. Peristalsis, going to the bathroom, going poop, decreases because no time to poop. Small intestines, large intestines, both. Digestion slows down. It's reduced. In fight or flight, blood is going to essential organs to survive. Now is not a time to digest. Liver, it converts additional glycogen to glucose. So glucose is that sugar, the energy we need in our blood. So glycogen starts getting converted to glucose so that we can last a long time. Kidneys, as you'd imagine, decrease urine secretion, decrease urine production. Adrenal glands. So out comes the adrenaline. So adrenaline is the common name for epinephrine and norepinephrine. So it's the scientific name of adrenaline is norepinephrine and epinephrine. And then of course in the bladder, we're not going to the bathroom, we're not peeing. We're just things are closed. All right. By comparison to the parasympathetic nervous system, pupils constrict. I think I put a slide on this. I did, yes. So when you're first waking up in the morning, you know, like if there's bright light, bright sunshine, ooh, pupils constrict. Ooh, it goes because there's bright light, you can see everything, but we don't need to look for predators. So actually so this is a picture of the pupil constricting. So saliva production increases. Saliva is actually one of the ways that we digest food. Digestion actually starts in the mouth with mastication, chewing, and the saliva has a little bit of HCl, hydrochloric acid, HCl. Yeah, hydrochloric acid. And it helps start to break down the food. Mucus production increases during rest and digest. I mean, it's part of the reason people say, oh my gosh, I'm going on vacation, I get a cold. You don't actually have a cold. Your body's just able to produce more mucus to get a bunch of that stuff out. So you'll be fine for your vacation. Heart rate goes down during rest and digest. Breathing muscles just go to neutral because the breathing is going to slow down. We've got gastric juices being secreted because absorption and digesting will go up. Small and large intestines. Increasing motility means if it says increasing motility, it's increasing movement. So increased motility in the large intestines, again, means pooping. So anyone with irritable bowel syndrome, when they get massage and their nervous system calms down, their stomach can feel better. Gastroenterologists across the nation agree stress plays a major role in irritable bowel syndrome. Yeah. Kidneys, the urine secretion goes up. It's actually safe to go ahead and let's clean up. Let's get this out of here. So a lot of times after massage, my clients are like, okay, of course, I need to use the bathroom. It's a relaxation response. Yes. So again, and that bladder will relax. Um, Things will just move more efficiently through our digestive tract and our urinary system because it's safe. We're resting, we're digesting. All right. Moving away from the nervous system, it is intimately connected with the endocrine system. And for those of you who have been here for a couple of weeks, more than 2 or 3 weeks, we did a deep dive recently on the endocrine system, and the endocrine system produces hormones. These are the glands that in the anatomy and physiology lecture that we covered in depth. But this is how we're going to look at the benefits of massage for the endocrine system. So, reduces anxiety. Depending on hormone levels, people can feel a certain level of anxiousness. By balancing those hormones, we reduce anxiety. Promotes relaxation. Decreases beta wave activities. So beta is when we're thinking. Beta waves means that you're actively engaged in thinking. And so massage calms down those beta waves, as does meditation, by the way. Meditation reduces anxiety, promotes relaxation, decreases beta wave activities. In massage, we create a meditative state. Yeah, similar, very similar. Massage will also help to increase the alpha wave activity. So alpha waves they're there when we are not aroused. It's a funny way to say that, but when we're calm, there's more alpha waves. So we talk about people being the alpha male, dogs being the alpha male and it's aggressive, but that's not what it means here. Brain waves demonstrate a calmness. And an increase of delta waves, also during massage. Delta D, deep sleep. Delta D, deep sleep increases those delta waves. This is all happening in the brain, by the way, these waves. Yeah. When our brain is more balanced, it lends itself to homeostasis. And that's a big benefit of massage to the endocrine system, promoting homeostasis. We increase They increase the delta waves, deep sleep. We increase the alpha waves, the chill out waves, and also dopamine levels go up, as well as serotonin levels go up. So that's dopamine, that overall feeling of wellness, goodness. And serotonin helps to regulate our sleep cycles and our light and dark. And so it helps to regulate our sleep patterns, and therefore massage also helps with deeper sleep. So the delta waves, deeper sleep, better sleep, because of better serotonin levels, balanced serotonin levels. Massage reduces cortisol levels. Cortisol is another hormone produced by the adrenal glands during fight or flight. Reduces adrenaline, reduces epinephrine and norepinephrine, and reduces also those feelings of depression. Depression has been linked to hormonal imbalances. By balancing the hormones, helping to balance. Now, massage is not going to, well, I shouldn't say that. Massage can benefit depression, but depression, guys and gals, is a serious condition and it needs medical attention. Some people have seasonal depression and they can use a happy light, a vitamin D light to offset that depression. However, we do definitely need to take seriously if our client puts depression on their chart. So just be sensitive to that. Massage can help though, because it promotes that dopamine, right? That feeling of well-being. And we've talked about improving sleep patterns. Good. All right, take a breath. We're covering a lot of benefits of massage today. And with that breath, let's move into our respiratory system. So in our anatomy lessons, we cover all the different aspects of the anatomy of the respiratory system. How does massage benefit the respiratory system? So you may think, okay, well, it increases our respiration, doesn't it? Actually, think about the rate. So what we're saying here in this slide is that massage reduces how quickly you're breathing. So those short, shallow breaths so massage makes those breaths longer and deeper. That's why it reduces the respiration rate, because it strengthens the respiratory muscles by making those deeper breaths. Massage decreases the frequency of asthma attacks because it helps to balance the musculature around the lungs. The muscles that are in between the ribs and the diaphragm, of course, give us respiration. The diaphragm sits underneath, but in between the ribs are also respiratory muscles. Those muscles are called, put it in the chat. What are the muscles in between the ribs called? Put it in the chat. If it's safe, if you're not driving, get in. And if you can see, some people are on your phone, that's fine. I'll tell you in just a minute what those muscles are called. But that's how massage helps to decrease asthma attacks, because it helps a person breathe more easily. Massage helps to increase fluid discharge from the lungs. We talked about sneezing and using tapotement on the thoracic rib cage, on the thoracic spine to promote phlegm discharge, mucus discharge from the lungs. And massage does play a significant role in improving the function of the lungs, the pulmonary function, by loosening those tight respiratory muscles called, let's see, Dantasia got it, Pathithia, yes, Ms. V, yes, good. Intercostals, yes. So ribs are sometimes referred to as costals. our intercostal, our vertebral costal joint, our sternocostal joint. Yeah, ribs are called costals. That's their scientific name. And intercostal is the muscles of respiration in between your lungs. Expands the rib cage and contracts the rib cage. Good. All good. All right. So you can feel free to misspell or abbreviate because on the MBLEx, you're going to have multiple choice. You don't have to pull it out of just out of your hat. Okay. How does massage benefit the integumentary system? We have 3 more systems to go, so hang in there with me. Integumentary system. It is comprised of our skin. It's our largest organ. Hair, scales, feathers, hooves, nails. Yes, all considered integumentary. Largest system of the body. Benefits of massage to the integumentary system. With friction, we can increase the skin temperature. And when, well, friction, effleurage, petrissage, that can all increase skin temperature. By increasing the skin temperature, we also improve the skin's condition. How so? We stimulate oil glands. And I wanted to point out, is this the slide? Yes. Okay, take a peek. So it stimulates our sebaceous glands. Here's the hair follicle. And it stimulates our sebaceous glands. These are our oil-producing glands. So oil is one way we lubricate the skin to keep it nice and moist, which is different than our sweat glands. See? Totally separate. Be careful. Sweat is not sebaceous. Okay? Sebaceous is an oil gland. Sweat produces perspiration, hydration. All right. And so if you see apocrine, it's actually related to the sweat gland. We've talked about massage improving the appearance of skin because it sloughs off dead skin cells, but it improves skin condition by moisturizing, exfoliating, and increasing the elasticity of skin. It actually reminds the skin how to be more toned when we massage the skin. It's part of the reason that women get facials, right? And it's to increase that tone, increase that elasticity of the skin. And we've talked about, when we talk about the integumentary system, we talk about the traditions in the country of India of massaging the stomach after childbirth to, again, help increase the elasticity of the skin after childbirth, after it's been stretched. All right, moving along to the digestive system. We're doing well today on time. Good, I'm pleased. So the anatomy of the digestive system is covered in anatomy and physiology. So let's look at the benefits of massage to the digestive system. So it promotes the evacuation of the colon, motility of the colon, meaning your ability to ingest food, digest food, and eliminate food. So the digestive system helps improve. So evacuation of the colon could also be considered the excrementory system. We're making the small and large intestines part of our digestive tract, which it is. Relieves constipation. You're like, what? Yes, and clients may or may not tell you that they're constipated, but by calming down the nervous system, and there are studies done on the effectiveness of abdominal massage to help relieve constipation. Yes, that would be a mechanical benefit of massage. Massage also helps to relieve colic and gas. Think about infant massage. Or what do we do when a baby needs to burp, right? Baby is on the shoulder, tuk, 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 tuk. Tapotment, you guys. Tapotment is burping a baby. Yes. Pretty cool, huh? I like this little quip. Thank you to Marinos who produced a humorous birthday card. Um, and one dog says, I offer emotional support. I detect cancer and other human diseases with scent detection. And the little guy says, I squeak fart when I'm startled. A little comic relief. Massage helps to relieve that colic and intestinal gas. It helps to move it through the system. It also helps to increase digestion and improve absorption. So by calming down the nervous system again, the body can do something that it does during rest and digest, which is increase digestion and improve absorption. All right, two more systems of the body. Urinary system, the anatomy, we cover in A and P, but it's the bladder, the kidneys, the ureter, and the urethra. Yes. Um, and so this is obviously male anatomy here, but mechanisms of the urinary system are these four, excuse me. But what are the benefits of massage to the urinary system? It will increase urine output. Oh, good. Here's a female picture. Forgot I threw her in there. Increases the urine output, so the amount of urine that your body is producing. It also increases the concentration of wastes in your urinary system. So the amount, the concentration, so what is being excreted? So nitrogen, phosphorus, and sodium chloride, salt. You may have heard someone in your, past say about urine is salty. Yes, it is. Because you're getting rid of sodium chloride, you're getting rid of too much salt in your body through your urinary system. So we'll leave it at that. And finally, the reproductive system. Regular massage could improve the blood flow. This is from a scientific article. Could improve the blood flow to the organs of the reproductive system and deliver the hormones present in the bloodstream to its destination. So it helps to deliver hormones that will stimulate the reproductive system. In fact, this came from a study on in vitro fertilization. Yes. So in vitro fertilization looked at the benefits of massage for IVF. Massage is also thought to release the feel-good hormones, dopamine, oxytocin, which leads to a healthy hormonal balance because there's good evidence that stress affects the reproductive system. Stress affects every system, right? But it can affect men and women. So, massage could reduce the stress and make you more relaxed, which can help with conception. Um, Women with infertility issues, men with erectile dysfunction often are dealing with more stress and are a little anxious about the condition. So just know though that fertility is not just related to circulation. There's often multiple factors involved if we're looking. And it's a whole specialty that you can go into if you're curious about fertility massage. Yeah, helping mommies to conceive. All right, time to switch gears. Time to do a little dissecting of the questions. All right. In this section today, if you would please put your answers in the chat, and if you would wait until I say go to send those answers into the chat. I appreciate when people direct message me. I'm not always able to direct message you back, but we're going to just put this in the general community chat when I say 3, 2, 1, go. This will give, and I'm going to pace myself and you as if we were taking the MBLEx. You get about 70 seconds per question. It's kind of a long time, to be honest. We're not going to take 70 seconds per question. Yeah, that's about just a little over a minute that you get. We will be taking about 45 to 60 seconds on these questions, though, because I'm going to read them, read the question, read the answers, and then I'm going to reread the question, and we're going to eliminate one wrong answer. And this is a great technique to use during your MBLEx. Read the question, read the answers, read the question again, and then eliminate a wrong answer. You know it can't be that, so just get rid of that, and then pick your best answer. So we're practicing that technique today. If you feel anxious while we're going through this, breathe. Remember your beautiful earth breath. You can breathe in for 4 and out for 4. And just know that that's only 8 seconds, guys. It's a beautiful thing. Breathing in for 4 and out for 4. Try it. You may be surprised at how oxygen can help you remember. All right, first question. Massage broadens and stretches muscle tissue, decreases fascial adhesions, gets rid of dead skin cells, and breaks up and reforms scar tissue. This is called a blank. A, reflexive effect. B, cross-fiber friction. C, mechanical effect. D, neuroplasticity. Massage broadens and strengthens muscle tissue, decreases in fascia adhesion, gets rid of dead skin cells, and breaks up and reforms scar tissue. This is called blank. Can you eliminate one wrong answer? What do you know? Let's do it together. What do you know is not right? You know it is not neuroplasticity. Neuro, brain, right? Neuroplasticity refers to the rubberiness, the elasticity of our brain as we age and keeping our brain healthy. That is not broadening and stretching muscle tissue. So it's not that. Massage broadens and stretches muscle tissue, decreases in fascial adhesion, gets rid of dead skin cells, and breaks up and reforms scar tissue. This is called a blank. 3, 2, 1, go. Ooh, lots of answers. Mm. Yes, Dantasia. Yes, Stephanie. Good, Diane. Yes, Patitia. Ms. V, you got it. Good. Way to go, Lisa. Yay, Carrie. Leisha, yup. Leah, yup. Lek, yup. Vanessa, yup. Tia, yup. Good. Good, good, good. You were not confused. I'm so glad. Best answer, letter C, mechanical effect. And if you can't see the buttons on your phone, you can't see the buttons, don't worry about it. You have a piece of paper. Write it down on your piece of paper. Yes. Yes. Good. Nobody chose cross-fiber friction. That could have been an answer. That's a good answer, but it's not the best answer, right? Yeah. Okie dokie. Next question. Name a benefit of massage to the SNS. Name a benefit of massage to the SNS. A, reduces blood flow to non-essential organs. B, increases blood flow to digestion. C, decreases heart rate and blood pressure. D, respirations deepen, slows down. Name a benefit of massage to the SNS. Sympathetic nervous system, SNS. Name a benefit of massage to the SNS. Let's get rid of one wrong answer. What answer will we eliminate? Let's get rid of, boom, decreases heart rate and blood pressure. Wait a minute. Massage does decrease heart rate and blood pressure. Okay, let's go back to the question. Name a benefit of massage to the SNS. Name a benefit of SNS response. Is not what the question is saying, but answer is the same. So, is it A, reduces blood flow to non-essential organs, B, increases blood flow to the digestive system, D, respiration deepens and slows down? 3, 2, 1, go. Mm-hmm, mm-hmm. I love it. You're all over the map here. Hee hee hee. Oh boy. Okay. 100%. Nobody got the answer. What is the benefit of massage to the SNS? Letter A. So I may have thrown you off by saying massage, but the question is actually asking, name the benefits of the SNS response. What is a benefit of the sympathetic nervous system? So it's a tricky question, right? Very tricky question. Because you would think we are trying to eliminate the sympathetic nervous system response. And I think by adding massage, I probably threw you off. So my apologies. I had reviewed these questions prior to and found this to be a challenging question. But the benefit of the sympathetic nervous system is it does reduce blood flow. It's the function, it's not necessarily a benefit, but the function of the sympathetic nervous system is to reduce blood flow to non-essential organs, like the digestive system, the urinary system, allowing it to increase blood flow to the heart and lungs. Now that's fight or flight. We're talking about fight or flight. So let's take a peek here at the feedback. Good. Yes, yes, yes. Yes, and I absolutely will explain once again why it is A. So let's start from the beginning of the question. Name a benefit of the sympathetic nervous system. If I didn't embellish the question, name a benefit of the sympathetic nervous system. One benefit or function. So B, C, and D are all parasympathetic. Take a peek. Increases blood flow, parasympathetic. Decreases heart rate, parasympathetic. Respiration deepens, slows down, parasympathetic. Sympathetic nervous system reduces blood flow to non-essential organs. During fight or flight, sure does. That's a benefit because, as we look at the answer, why is that a benefit? It reduces blood flow, allowing it to increase it to the heart and lungs. So it reduces blood flow to non-essential organs, increases it to the essential organs. Sorry, guys. I know it's a tough question. I didn't make it easier by embellishing. My apologies. Good, thank you. Can you give us an example on the answer being D? Absolutely. What is a benefit of the parasympathetic nervous system response? What is an effect of what is a benefit or effect of the parasympathetic nervous system response? That would be letter D. It would also be letter C and letter B. So B, C, and D, all parasympathetic responses or benefits of that parasympathetic response. Yeah, I know. I know. I know. Well, I didn't help by adding the words massage in there, so my apologies. I'll make a note of that for next time. All right, let's keep going. Press forward. Which of these benefits of massage is an example of impact to the parasympathetic nervous system? Which of these benefits of massage is an example of impact to the parasympathetic nervous system? A, breathing becomes shallow and quick. B, decreasing blood flow to the stomach. C, breaking up scar tissue. D, lowering blood pressure. Which of these is a benefit of massage? Which of these benefits of massage is an example of impact to the parasympathetic nervous system? I'm going to get rid of one wrong answer. A, breathing becomes shallow and quick. B, decreasing blood flow to the stomach. C, breaking up scar tissue. D, lowering blood pressure. One of these things really does not belong in this list, right? Boom. Breaking up scar tissue has nothing to do with the nervous system. It is a benefit of massage, but it's not to the parasympathetic nervous system. Okay. Which of these benefits of massage is an example of impact to the parasympathetic nervous system? A, breathing becomes shallow and quick. B, decreasing blood flow to the stomach. D, lower blood pressure. 3, 2, 1, go. Go, 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 speed racer. Go. Ooh, we got lots of answers. We are clear on this question. Yes, Lydia. Yes, Diane. Good. Lisa nailed it. Vanessa, good. Dora, yes. Leah got it. Ms. V, in. Alicia, yep. Carrie, yep. Tia, yep. Petitia, yep. Kersha, yep. Lek, yep. Good. Best answer, lower blood pressure. Why? Because A and B are sympathetic response. Look at how much you've learned in one question. You turned that right around. Good job. All right. Reddened skin associated with increased blood flow is called blank. Reddened skin associated with increased blood flow is called what? A, hives. B, ischemia. C, hypertonicity. D, hyperemia. Reddened skin associated with increased blood flow is called what? Let's get rid of one wrong answer because something just doesn't belong here. Ooh. Somebody think that it was hives? We did talk about histamines. We did talk about red blotchy skin, but that's not the best answer. Reddened skin associated with increased blood flow is called B, ischemia, C, hypertonicity, or D, hyperemia. 3, 2, 1, go. Lek, Patithia, Lisa, Lisha. Yes. Kersha, good. Carrie, yep. Ms. V, got it. Oh, I know you, some of you want to say B. I know, but best answer is D. Reddened skin associated with increased blood flow is hyperemia. Ischemia is a lack of blood flow. It's the exact opposite. It's your heel tissue. Heel tissue is ischemic. Yes. After we gua sha the back, hyperemia. After we compress, after we do cross fiber friction, red skin, hyperemia. We've mechanically stretched, vasodilated those blood vessels, and now blood is flowing in. Mm-hmm, 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 mm-hmm. Yep, yep. I know. That's why we do this. That's why we practice. Name a benefit of massage. Name benefits of massage to the integumentary system. Name benefits of massage to the integumentary system. A, hyperemia. B, lengthens muscles. C, allows sebaceous glands to activate and release oil. D, releases excess mucus. Name a benefit of massage to the integumentary system. A, hyperemia. B, lengthens muscles. C, allows sebaceous glands to activate and release oil. D, releases excess mucus. Shall we eliminate one wrong answer? Here we go. Wait a minute. Massage does lengthen muscles. Yes, it does. Name benefits of massage to the integumentary system. A, hyperemia. C, sebaceous glands activate and release oil. D, releases excess mucus. 3, 2, 1, go. Go, go, go. Nice. This is where I need the glasses. Miss V, yes. Milana, yes. Dora got it. Lydia got it. Vanessa nailed it. Petitya, yes. Carrie, yes. Lek, yes. Lisa got it. Latia, Tia, yep, you got it. Leah nailed it. Kersha, yep. Lisa got it. Zoom, oh, Datrina, got it. 3, 2, 1, best answer. Boom. C, y'all nailed it. Yeah. Does massage help to release excess mucus? Absolutely. Sure. But it's not in the integumentary system. Lengthen muscles sure does. Not part of the integumentary system. Not the best answer, anyhow. All right. And I believe this might be our last question. Let's see. Benefits of massage. Yep. No, I think we have 2 more. Okay. A general massage effect that includes changes in blood pressure and regulating melatonin levels is considered a blank effect. Okay. A general massage effect that includes changes in blood pressure and regulated melatonin levels is considered a blank effect. A, mechanical. B, physiological. C, psychological. D, reflexive. A general massage effect that includes changes in blood pressure and regulating melatonin levels is considered a blank effect. Let's get rid of one wrong answer, shall we? Watch what gets out of here. Psychological. Please pay attention. Both words start with PSY. PSY. Psycho, psychological. Psychological. Massage has psychological benefits, but this is not one of them. So a general massage effect that includes changes in blood pressure and regulating melatonin levels is considered a what effect? A, mechanical. B, physiological. D, reflexive. 3, 2, 1, go. Yes, Lek. Yes, Dora. Yes, Petithia. Yes, Leisha. Yes, Vanessa. Me, Ms. V, Carrie. Yep. Latia. Yep. Kersha. Yep. Yep. Raina. Yep. Good job. You weren't distracted. Best answer is letter D. However, a good answer is letter B. It is a physiological effect. Blood pressure, Melatonin hormone levels, absolutely, that's physiological all day long. But the best answer is reflexive. Very good. See how we nuanced that? Yeah. All right. General massage effect that includes reduced anxiety and heightens a person's sense of well-being is called what? Okay, this is a bit of a meatball, meaning kind of an easy one. So, but pay attention. General massage effect that includes reduced anxiety and heightens a person's sense of well-being is called A, mechanical effect, B, physiological effect, C, psychological effect, D, reflexive effects. Let's get rid of one wrong answer. General massage effect that includes reduced anxiety and heightens a person's sense of well-being is called not mechanical. Mm-mm. Would that be B, physiological, C, psychological, D, reflexive? And I will tell you right now, I'll tell you a little something after you pick your answer. Okay. 3, 2, 1, go. You gotta make a choice. What's the best answer? Lisa? Leah? Lek? Leisha? Carrie? Kersha? Ms. V? I agree. Best answer. It's a psychological effect. Yes, that is the best. Now, here's the crazy thing. Mechanical effect is not right, right? Definitely not. But letters B, C, and D are all right. Letters B, C, and D are all right. It is a physiological effect. It is a reflexive effect. Yep. But the best answer is it's helping this person's psyche. Their psychological health is being positively impacted by reducing the anxiety and increasing the sense of well-being. Yeah, I know. Hey, welcome to the MBLEx. That's it. All right. Good work, you guys. Excellent work on those questions. Woo, they were tricky. Hee hee hee. And really made you use your brain, right? Yeah. So, congratulations. Great work on those questions. Yeah. And also, you're here. You're here and it's, over 90 minutes later. So, congratulations. How are you feeling? Do a body scan. Do a quick check-in. Would you be ready to go for another 30 minutes, another 20 minutes? Welcome to the MBLEx. Yep. Ready to go for 2 hours. Yep. Ready to focus for 2 hours. That's what we're here for. Going to sign off on this recording. Thank you to all these lovely people who are here. And thank you to you as well. Thank you for studying. Thank you for holding the vision with us. We are with you. You are with us. We are holding the vision of being a licensed massage therapist, passing this MBLEx. So, thanks for being here, and we'll see you again real soon. Oh, my name is Jodi Skulls. I'm your instructor, and we'll see you again real soon.